Guys, we're going to try to do a quick EVD setup. So you're going to take your Crani Access EVD box and call your ICU charge nurse and have them start bringing you down the monitor, because you cannot zero any of the bolt or the EVD, anything, until they get there with that. So call them so they can start heading down. And in the meantime, you can set this up. So you're going to need 3 things out of our kit. You're going to need your drain, your actual EVD. You're going to need this True Wave. You'll recognize it from your art line. And you're going to need this kit that has the preservative-free saline vial. Okay, so let's get this out first. So your drain is going to come out. This part gets connected to the patient's, to the bolt that goes in the patient's brain. So do be mindful to keep that tip sterile. Has a cap on it right now. So this has a little slider, which is going to be helpful in setting the height of it later. Adjust that up. Put that down. Your drain should come clamped, but do double check that it is. And then it'll come just set up like this. You're going to take your True Wave monitor, and we're going to actually throw away most of it. So you're going to want the part with the transducer cord and our pigtail, and our lines that we connect to it we don't need for this. And you're going to want the closed cap that comes in the kit. So this open cap, open air cap, that can go away. And you're not putting it on a patient's arm, so this part can go away too. This is going to connect to where this red cap comes. Nice and tight. And then you're going to have a clave. You can use the one from the bedside drawer that's going to go on here. I don't have one for this video, so we're going to soldier on without it, but do put a clave on that. You're going to take your preservative-free saline, sterile saline. You're going to clean it, draw it up, and handle that with care. And then we're going to flush 2 parts. So we're going to flush the part that's going to end up going to the patient, and we're going to flush the drain. So this has a little water in it, but we're going to have off to drain, onto patient, not actual patient. Don't touch it once it's hooked up to the actual patient, but the patient line. And we're going to flush all the way through. Obviously, we have a little bit of water from playing with it. We're going to turn it off to the line and onto the drain, and we're going to flush that through. Now that they want just to have a single drop of water, of saline, in. And then this is ready to set up to hand to the patient, or to the surgeon to connect to the patient. Keep this cap on until he's ready for it. Once this is connected to your patient, don't do any more flushing. In fact, the least you can touch this once it's connected to the patient's brain, the better. There is a couple things that you might be asked to do to set it up though. One of them is to set the pressure. So this line is where you read the pressure. Kind of a product flaw. This part is millimeters mercury. This part's of water. So a lot of overlap in numbers. Like if it's 20 millimeters mercury versus 20 millimeters water, those are 2 different places it wants it at. So just when they give you a number, verify which measurement they want to use. And this just goes up and down. This is kind of a screw and move. This little line here that's slightly covered, also maybe not the best way to make that product. This arrow should go with the patient's tragus. So you want just in that little cute part of the ear. And you will adjust that by going up and down here. So it's really helpful to have it on its own IV pole. You could do it on the bedside pole, but it's just a little easier to set this up without that. And that should be all ready for the surgeon. Again, don't flush it. Don't do anything after it's connected to the patient's brain. Just let the surgeons do that. Let ICU come help you with that. Once that's all set up, you can kind of wheel that out of the way until they get access. And then you're going to dig in the rest of this box. This is going to have your cranial access kit, all the tools you're going to need besides the monitor that ICU is going to need to bring you down. Their gowns, their bandaging supplies, everything that they're going to need. Just have it out, get it ready for them, but you're not going to open any of it. Just get it out and ready. Open the bag, but you don't need to like open the cranial access kit. Let them do that.